Hi, my name is Julie Powers, and this is the Fit Farmington Mo Healthy Living Showcase Sponsor Spotlight. And today we are talking with Dr. Jason Street from Sago Street Eye Care. And we're really excited because Sago Street is returning for the second year as a sponsor for the Fit Farmington Mo program. Now, Fit Farmington Mo is really focusing on our community becoming very healthy, nutritionally, physically, mentally, and emotionally. And what we love about this is our community sponsors are part of that partnership. And this is the City of Farmington Parks and Recreation Department and some passionate volunteers. And so we are here talking with Dr. Street, and we'll see if we can get going. So here we are with Dr. Jason Street. And Dr. Street, I would love to know what it is about the Fit Farmington Mo program that made you want to be part of that.
Well, when we read about it, or actually whenever you contacted us to become members of this, we felt it was your goals basically are to promote good health in the community, mental well-being, and that type of thing. And those are the exact same goals that we have for the community. Obviously, we are in eye care, and we want to promote good eye and vision health, but if people do not see well, it does affect their ability to do things that they want to do, like being able to drive or read a book or that type of thing. It also affects their mental health because whenever you lose your vision, a lot of people become depressed and it becomes an issue. So we felt like those goals really did align well with the Fit Farmington Mo program and wanted to promote that and become part of the community.
Well, that is great. And I see that you are standing inside your office, which is located at
102 Westmount Drive in Farmington.
And you have a lot of frames in the background. So you actually provide frames and glasses for people here. They don't have to order from an outside source.
That's
and
correct.
What would you like to tell us about that?
Well, I mean, we do have a large selection, probably more than a lot of eye care providers do. We probably have more than 1,200 frames here, so we do have a large selection. One thing that I wanted to talk about was the fact that we do try to sell the most technologically advanced lenses here as well. Just to give an example of that, I know a lot of the kids in this area are going virtual now with their school, and they're on these Google Chromebooks, and they're getting these harmful blue light radiation that's coming off of monitors, off of your phones, off of your tablets, and that type thing. We have lens technology now where we can actually put coatings on the lenses to block that blue light, so that's kind of a neat technology type thing that will help maybe prevent macular degeneration as they get older. We also do things here like contact lenses, obviously. There's all kinds of new technology there as well. We even have lenses now that transition, like when you go outside, and they actually regulate light. So it's like a transitions lens, which everyone's probably heard of in classes, but you can now do that in contact lenses. And then coming very soon, we hope, will be a lens that's going to come out that will affect a lot of people in this area because everyone suffers from allergies. But they're going to come out with a new contact lens that actually has an allergy medication embedded in the lens that is going to allow patients to be able to wear contacts that's never been able to do that before. So we try to stay on the cutting edge and keeping new technology in here and work on the optical side and try to provide products that we feel that's going to make our patients more functional in the real world and hopefully get them to see well.
Well, that is really cool. I've never heard of contact lenses that can actually transition like the glassware or the glasses. And I know that a lot of people think, oh, it would be so much cheaper to order online, but then you don't get that perfect fit sometimes. And when they're ordering like bifocals or trifocals, you have to have somebody really putting things in the right place. Can you talk about that a little bit?
Yeah, absolutely. If things aren't measured correctly and they aren't set up correctly on your eyes, not only can they affect the functionality of the lenses, but it can also affect your ability to work and do things every day. So we are very critical here whenever we did take measurements, and we stand behind our product. If there is ever any issue with them, we will certainly correct it and make it better. But when you buy stuff online, sometimes you don't get that personal care, and sometimes you don't get the attention to detail that you will get when you buy stuff here.
Very good. Are there other products or services that you would like to make sure people know you have available here?
Yeah, we have kind of going away from the optical side of things, a lot of people don't understand or don't know kind of what the difference is between optometrists and ophthalmologists. We do actually treat eye disease here as well. Optometrists basically have historically done glasses, contacts, that type of thing, but we also treat eye diseases. So if you happen to have an eye infection, or if you get a foreign body in your eye, happen to get a splash in your eye with chemicals, or stick yourself in the eye with a pen for some reason, which never happens.
Hey, wait a minute, I know that story.
So you get an corneal abrasion and those types of things. So we do treat ocular disease as well. We can pretty much do everything ophthalmology can do up to the point where you need surgery. And once you need surgery, we kind of have to do refer out for that. But we still co-manage surgeries such as cataract surgeries, that type of thing. We see a lot of patients who are diabetic, and we can kind of monitor if they have diabetic retinopathy or anything wrong with their eyes, and we work with a retina specialist on that. But there's lots of things ocular disease-wise that we do here as well, above and beyond just the optical side of things.
All right, and so it's your staff includes you and Dr. Sago.
Yes.
And you have other trained optical technicians or
Yes.
optician technicians?
We have optical technicians and opticians here. Yes.
Okay. And so really, whenever somebody comes into your office, they know that they can get full service. And what are the hours here?
We are here Mondays 9 to 7, Tuesday, Thursday, Friday 9 to 5, and Wednesdays 9 a.m. to noon.
Great. And you treat people of all ages?
We do. We pretty well see anyone from about 4 or 5 years old all the way up to, in their 90s, well into their 90s.
Very good. And now I know that you have some very specialized equipment that you would like to make sure people know about.
I sure do.
And we're going to just stop the video here and move to another location. All right, so we are in the back part of your office now, and a patient would come in, and this is where you have your equipment to do some testing. Can you kind of explain how this works?
Yeah, this is kind of where the exam starts. And a lot of my optical technicians actually run you through some of these machines. We can pretty well do these on anyone. Sometimes on kids it's a little more difficult to try to get them to stay still, but we do try to run these machines on everyone. This machine here is the dreaded air puffer that everybody hates. It's called a non-contact tonometer. It actually measures your eye pressure, which whenever you have glaucoma, sometimes your pressure is high, and that's why we use this as a screening test to try to see if your pressures are too high for your eye. So that's one thing we do. This is actually a new piece of equipment that we have not had very long. It is what's called an autorefractor. It basically gives us a ballpark idea of what your glasses prescription is. It also takes measurements of actually the front of the eye, so when we fit contact lenses and that type of thing, we know what kind of curves of contacts to be able to fit you in. There's a lot of technology here in just this one machine, but it kind of gives us that in all under 30 seconds. I mean, it's pretty amazing how the technology is. Another thing we're really proud of is this is called a Maestro optical coherence tomographer. It's OCT for short. And basically what this thing does is it actually takes pictures of the back of the eye, and it also images the back of the eye, similar to what we're doing with it's kind of like an MRI technology. I'm going to turn the lights out here so you'll be able to see the screen behind me. This is actually a picture of me, so I'm not giving up anybody's patient information but my own here. But if you can look, what's neat about this is it takes a picture of the inside the back of the eye. So if you look here, this is your optic nerve, so that's what actually sends the signal back to the brain to get the image from inside the eye to the back of the brain. This dark spot here is called your macula. That's your central vision, which that's whenever I'm testing you in the exam room and I ask you which is better, 1 or 2, that's actually the part of the retina that you're using to see that with. That's your central vision. What's neat about this, I don't know if you can see it on the screen, but there's a green box around this, and this thing uses technology that actually scans the retina and then images it like I did an MRI of your eye. So where this green line is right across the middle here, that's like me taking a knife and cutting you right there, and if I flip it over on its side, I can see the side image of your retina right here. So whenever I look in your eye, this is what I see. But what I can't see is everything that's under the retina, which is under here. And what's kind of neat is I can grab this green line, and as I move this green line, you can see your retina changes. So I can move this green line anywhere inside this box, and I can actually look at the image underneath your retina. okay? So it's really neat technology. Now this is obviously my eye, and this is normal, so that's what you're supposed to see. This is your central vision, is right here, where that little dip is at. That's called your macula, which is that dark spot right there, okay? And you want this line to be real flat and smooth. What's kind of neat, I'm going to take you to a report it gives us, and this is a report of my right eye. And you can see down here, it actually compares me to a normal population of people that is my age and race, okay? And this black line actually represents me, and you want to be either in the white area above or in the green. And you can see all my quadrants here are pretty well green, which means I pretty well have pretty healthy eyes on the inside. So what's neat about this is it compares you to other people, and it gives me a lot more data than it did years ago when all we did is we could just look inside your eyes, okay? So this is a really neat technology, a really neat tool, and we do offer this as a screening on everyone that comes in for eye exams. You don't have to get it, but it is something we recommend you do because it gives us so much more information and data about the inside of the eye. What this is kind of equivalent to, if you think about it, and I'm going to show you a poster on the other side, if Jill, if you can flip that light on. So what they kind of use, this is this is the iceberg of the eye, if you will. What this is representing is the iceberg that you see above the water. You can kind of see it here. But all this stuff that can go wrong with your eye actually happens below the ocular surface. So not only can I see the tip of the iceberg, I can actually see below it with this new technology. And if you look here, this talks about diabetic macular edema. It talks about glaucoma. It talks about macular holes or any kind of tear that you can get in the retina will show up on these types of things. And what's great about this is if we can catch this stuff early on before it becomes a problem, there's a good chance we could save your vision possibly and prevent further vision loss, which again kind of goes back to the goals with Fit Farmington, Missouri, that we want to promote health and promote mental well-being and that type of thing. I'm going to kind of move you back over here real quick, and I'm going to show you one that's actually of just my macula, which is just my central vision. Let me get to it real quick. Because whenever you do actually have a pathology that there's something wrong with the inside of your eye, I can actually zoom in on one part. So this is just the macula part. You can see now the green box is just around one section of the eye. And what's neat is this scan down here. So I can actually view in three-dimensional imaging what your actual retina looks like, which is kind of neat. It allows us to tell if there's swelling or edema there. It also allows us to know if we need to refer you out to see like retinal specialist or some type of specialty that needs to take care of whatever's wrong with your eye. So those are the types of things that we can detect now that we've never been able to do before. So we're really excited about that.
And so to make an appointment, should somebody just call the office, or do you have online options? And I know that you have a Facebook page for Sago Street Eye Care. We
do have a Facebook page. We also have a website. You can go on the website and request an appointment. And how that works, we don't actually have online appointments yet. We haven't pulled that trigger yet, but what you can do is you can contact us from that page, and we will contact you and set up an appointment. You can also call our office at 573-756-3170 and certainly schedule an appointment with our front desk person.
And what is the website address?
It's sagostreet.com.
Okay, very good. And is there anything else you'd like to share with anybody out here listening and learning about Sago Street Eye Care and how you are partnered with Fit Farmington Mo?
Well, pretty much I basically want to convey that we are kind of a full primary care eye care facility here, because we do everything from the glasses and the contacts, which is kind of the old adage that everybody knows optometrist does, but we also do a lot of ocular disease treatment here too as well. And we want to make sure that people understand that, even if it's on the weekend, we have our voicemail is set up. My cell phone is actually on that voicemail. So if you need someone on the weekend, as long as I'm around, I'm more than happy to help you out. And if I can't, if I'm gone, I try to figure out a way to get you seen that weekend. So we try to provide that and want to be part of the community, and we want to take care of everyone here. So
thank you so much, Dr. Street.
Appreciate it.